I want to talk about loneliness, and this is something we've added recently. Recently means 2 years ago, and we have several hundred assessments, so it's time that I share. Loneliness is not being physically alone, and that's common for senior citizens when there's loss of partner or social isolation. I'm talking about loneliness that is perceived even when the individual is among people, family members, friends. So this is the loneliness I'm talking about. Loneliness needs to be part of any psychologist, psychotherapist or psychiatrist assessment for the clients because it contributes significantly to many conditions such as insomnia, suicide behavior, depression. So I will talk about what the research says on loneliness, what is our insights, and how this should be incorporated in the daily work. I will summarize several systematic reviews insights available based on recent research. First, one systematic review published last year talks about loneliness connected to issues such as loss of partner or social isolation or any major event where the individual has felt being socially disconnected in the world. These are common predictors of loneliness. Second, research also identified similar situations. Let me go through specific ones. Not being married or partnered. This is one component. Second, a limited social network. Third, self-perceived health or other issues, including depression. People who are depressed also feel loneliness and vice versa. So these are two major systematic reviews findings. You can see the reference in the link. More recently, individuals who have been exposed to childhood trauma feel more lonely in adulthood. This is again a systematic review. So this is a very new and recent insight because the childhood trauma research is nascent or recent in about 3 decades. And therefore, understanding what happened 20, 30, 40 years ago during childhood plays an important role in adults' feeling of isolation or loneliness. And this is where we zoomed in. We also assess other situations such as loss of partner or depression or insomnia. However, we zoomed in childhood maltreatment to understand which specific components contribute to loneliness because loneliness contributes to many such issues further down the line. We have presented our findings so far at National Academy of Psychologists recently in a conference. We are also working on some research papers, so I will share high-level details. More will definitely follow in subsequent videos. First and the most important point, loneliness, based on our data of several hundred individuals, is strongly associated with depression, anxiety and insomnia in that order. So highest or strongest correlation is with depression and then the other two components. Loneliness also is negatively connected with perceived social support. So higher the loneliness the individual feels, lower social support and vice versa. This is second finding from our research. And finally, loneliness is also correlated or linked to suicide behavior, and this is serious because, as I have shared in other videos, suicide is a primary cause of death of young men and women in India, and therefore it is important for us to understand anything that is linked to suicide behavior. These are three major findings from our research. Now, zooming in, remember we talked about a systematic review that linked childhood maltreatment to adults' feeling of loneliness. We have that data also. So childhood trauma and its intensity and frequency is strongly associated with adults' loneliness. That's also something we have found in our data. Second, specific components need to be identified so that we can address them. Include presence of emotional neglect, peer isolation, and emotional abuse. These three are major contributors to adults' loneliness. So these three things happening during childhood in high frequency and intensity are strongly linked to long-term feeling in the adult for loneliness. And that loneliness further increases the risk for depression and other situations or behavioral issues such as suicide behavior. So what does it mean to us? If you feel lonely, please get help. That's first point. And for people who work with individuals who have had depression, anxiety, sleep issues, suicide behavior, trauma, assessment of loneliness is absolutely critical and necessary. You can see what we use, UCLA 3 questions loneliness scale, very reliable, validated across countries, and we have good data on that. That makes a lot of sense. To summarize, loneliness plays an important role in increasing the risk for depression as well as suicide behavior and many such behavioral issues. So therefore, it's important to understand the drivers of loneliness and not limit them to being alone, loss of partner, or social perceived isolation, but also the history of childhood maltreatment. And that needs to be incorporated. And finally, we also have data emerging that highlights that parents who feel lonely are less likely to follow authoritative parenting style, which is a desired parenting style that balances the degree of control and the warmth. So loneliness has far-reaching implications and must be incorporated in assessment and therapeutic interventions to address the loneliness.